CPR compressions is what many of us were taught to do when saving someone's life, but now physicians are trying out ECPR and using new technology to increase these chances of surviving cardiac arrest.
Well, Claire Alfrey on your side this morning explaining what all this is and how UF Health has already seen some success as they have saved their first patient.
This is what Frank woke up to in the hospital.
I was completely dead.
After having a heart attack.
They said I died 4 times.
It wasn't just the nurses and doctors with UF Health that brought him back to life. Frank and the health professionals give credit to VA ECMO, a machine that performs ECPR, and emergency medicine physician Dr. John Bruno says it's increasing the survival rate of patients going through cardiac arrest.
And we divert blood out of the patient into this pump, into this oxygenator, and then put it back into the human body. And the purpose of that is that it takes the place of the lungs and the heart.
To buy physicians more time so they can restart the heart. Dr. Bruno adds, when combined with the traditional CPR compressions, ECPR increases a patient's chance of survival and the ability to go back to their normal lives from 0 to 30 to 40%.
Frank would have been declared dead soon after arrival. And I think in his case, getting on ECMO is exactly what gave us that time to get him to. In his case, it was to get open heart surgery.
After being discharged from the hospital, just 2 weeks later, Frank went back to work. A miracle the doctors and nurses at UF Health still talk about.
Like they told me, I was dead when I come in. You died 4 times. And they put the machine on you and you're here. You got the chance to get on it, it's worth every penny. I mean, it's worth it.
Although he is the first patient to be saved in northern and central Florida using ECPR, Frank knows he will not be the last. Claire Alfrey, First Coast News, on your side.